All right, so I am Christina. I am with Women Who Explore, and we are here tonight with Dr. Nancy East, who is going to tell us all about canine explorers. If you have any questions or anything, you can pop those in the chat, and I will be monitoring that for her while she presents. So Dr. East, take it away.
All right. I'm going to get my slides pulled up here if I can remember how to do it. And let's see, present. There we go. Is that looking okay, Christina? Good. Excellent. Okay. So thank you for those of you who are here, and I know people might come in and out. It's 9 o'clock Eastern time. I'm sitting here in Western North Carolina, and I'm going to move. I know you guys can't see what I'm doing. I'm going to move everybody's faces over here for just a second so I can see my slides. Uh-oh, what did I just do? All right, here we go. So if you guys can't see something, let me know. Christina, let me know if you can't see the slides, but hopefully you guys can see a slide with my name on it and just a little bit of bio information about myself. I have been a veterinarian since 1997. I went to Auburn University and then moved to the mountains as fast as I could. I grew up in Atlanta, but was never a city girl. Always wanted to be more of kind of a mountain hillbilly, I guess. But I practiced full time for about 7 years until I had my first child. And then I was fortunate enough that I was able to go part time after that. And I did a lot of relief work from that point on till when I retired, and then worked primarily in a practice here in my town towards the end for the last 6 years or so, still part time. So I've been out of clinical practice for about 4 years now, but I still do a lot of outreach and education in this capacity, and I love it. I'm on our county's search and rescue team, and so that inspired me to do all sorts of things as sort of a second career, such as this. And I do some writing. I set a speed record in Great Smoky Mountains National Park 4 years ago by hiking all the trails in record time to raise money for search and rescue. And that's my book there in that picture. Yeah, and then that's my website right there. There is a document that corresponds to this lecture tonight. So if you guys want to see that, feel free to jump on the website. I can't remember exactly the tab it's in, something like resources. And then if you do the drop down menu from there, it should be fairly obvious. If not, just poke around. You should be able to find it pretty easily. And I'll update it because I've added a few slides just to account for the people who are on the western side of the country. Things like altitude sickness, we don't have to deal with here. So I'll add some more notes to that document. But what we want to cover tonight are just these four broad categories. Before we even hit the trail, we want to always look at the things that are going to set us up for success with prevention and best practices. First aid, of course, we'll cover in a lot of detail. I do want to cover probably briefly through hiking, dogs who, or owners rather, who want to take their dogs on longer through hikes. And then we'll hopefully have some time for Q&A. And this may feel like drinking out of a fire hose. It's a lot of information. I'm going to try to get through it fairly quickly, but that's what the Q&A is for in that document. I'm always happy to answer questions also outside of this workshop, so my website has my contact info. But let's get started. Breed choice to me seems the logical place to start. Is your dog even a suitable candidate for hiking? Most of you probably already know this answer. I'm guessing that probably most people are already out on the trail with their dogs. But if you're not and you're just wondering, if your dog is a good choice, I'm going to say it depends on a lot of factors. Certainly, your veterinarian is the best definitive answer for that based on your dog's medical history. If it's older or has some pre-existing conditions, it might be of concern. But really, if you're thinking about just a run-of-the-mill dog who's in good health, has all its vaccines, all that good stuff, most dogs are probably a decent candidate for just day hikes, maybe even some backpacking, except for that cute little French bulldog or dogs that look like him in the lower right corner. Those are what we call brachiocephalic breeds. That's your $1 million word or $10 word for this lecture. They just look like they've been sucker punched. Those guys have a hard time breathing on a good day, much less when they're under exertion. So they're not my favorite for hiking. You know, if it's the right conditions and it's a really short hike, I'm not going to get too up in arms about it. My brother and his wife have four Boston Terriers, and so we'll go on short little jaunts here when they come to the mountains. But generally speaking, pugs, English bulldogs, French bulldogs, Bostons, they're just not my favorite for more rigorous types of hiking. But the dog you see in that book, the book cover Following Atticus, if you've never read that book, it's a great book. And it just goes to show that sometimes the most unconventional breeds will sometimes be very successful with hiking. So you really just can't assume that a dog is small, therefore it might not hike well. Atticus is a little schnauzer who did all the 4,000-foot peaks with his owner in the winter in up in New England. So, and I think they did them several times. It's been a while since I've read the book, but generally speaking, your dog is probably a decent candidate as long as it's not that brachycephalic breed. Another question people ask me all the time, or at least when I was in practice, is how old does my puppy need to be to hike? And I would say that varies a little bit just based on lots of things like skeletal maturity, if they're going to carry a pack anyway. If we're just talking day hikes, I would say just make sure they're fully vaccinated and they've gone through all that kind of that puppy series of shots, so to speak, and maybe even a few weeks after, just to let that immunity build up. But then skeletal maturity, I think, is pretty important for any dog that's going to carry weight on its back. And that varies by the breed. You know, it's not a one size fits all. A Chihuahua is going to reach skeletal maturity far quicker than, say, a Great Dane. So you just have to take that into account. Some of the giant breeds will take upwards of 1.5, maybe 2 years to get to that point. So you just want to ease into it depending on that. And build up with mileage. You know, it's just like us. You don't want to go out cold. And even with little kids, I would never have taken my 5-year-old kids on a 10-mile hike. They would probably say that I did, but I didn't. I did build up their tolerance and endurance to hiking. And you want to do the same thing with dogs, especially as they're developing. So recommended veterinary care, this is something that's a more personal discussion with your veterinarian. And I do encourage you to build that relationship. Just speaking from experience, veterinarians are far more likely to work you into, say, an overbooked schedule or at the end of the day if you're an established client, if you're someone who goes and buys vaccines, maybe at the feed store or whatever, and then just calls in a crisis. They may not be as quick to help you. I mean, they'll certainly want to help you, but you know what I'm saying. They're just going to take care of the people who've been really diligent about doing all their recommended prophylactic care, like physical exams annually. If you're an older dog or have an older dog, I'd say biannual is probably the more common recommendation. Vaccines certainly are paramount. Rabies, in particular, by law, everybody has to have it. The other run-of-the-mill vaccines, of course, you'd want to have too, but the two that are generally optional with most vets are leptospirosis, and that's something that if your dog hikes, I highly recommend it. Even if your dog doesn't hike, if it just goes outdoors and it is exposed to any types of water sources in particular, leptospirosis basically gets shed into water sources a lot of times by wild animals. Raccoons seem to be one of those animals that's more common with that. And it's a horrible disease. You don't want your dog to suffer from it. And if your dog's out on a trail, obviously it's going to be exposed to more urine from wildlife. So that's to me just a non-negotiable. It used to be back in the day. I've been out since 97, so it feels like the dark ages, but it used to be that lepto caused some vaccine reactions. Any vaccine can still cause a reaction in certain dogs. It's far less likely now, though. So there's still a stigma attached to poor old lepto, but it is a really good vaccine, and I definitely recommend that one. Lyme, talk to your veterinarian. That's too nuanced to get into tonight, but Lyme is pretty much everywhere now. It just continues to spread. It's become endemic, I feel like, in so many more places than it was 30 years ago when I first started practicing. So that one, there's some things you'd want to discuss about it, but Lyme is something to be aware of. Heartworm, intestinal parasite prevention, again, a no-brainer. Mosquitoes are how dogs get heartworms, intestinal parasites. Usually it's the ova, the eggs that live in the soil. And if a dog, eats a treat off the ground or whatnot, they can inoculate themselves really quickly. And most heartworm preventions have that baked into them. Tick prevention, another big one, not just for Lyme disease, for all the tick-borne diseases. There's lots of them. So do your best to do the appropriate tick prevention for your dog. That is also nuanced depending on, say, like your dog's coat, how often it's bathed, lots of factors. So hard to give just a blanket recommendation. We talked about the physical exam. If you've got an older dog or a dog that has some type of dysplasia, meaning that their joints didn't form the way they should, like hip dysplasia, elbow dysplasia, you may have some pain management type medications at home. I'd recommend, especially if you're on a backpacking trip, bring that with you just to have on hand. We'll get more into human medications as far as for pain. Generally speaking, don't give them, you don't want to give Advil, Tylenol, all that stuff. Some of them are just downright toxic. Some are very dose specific, like acetaminophen or Tylenol. It has to be very carefully dosed. And then another thing that I really like to encourage people to do is to just have your emergency veterinary hospital's contact information just plugged into your phone at all times, but especially when you're out on trail. Because if something happens, say your dog gets bit by a snake, it's in pain, it's, whining and all these things, you're going to be stressed. The last thing you want to do is have to look that up on the fly. So get that plugged in. So conditioning and etiquette, this is another biggie that a lot of people, myself included, will sometimes neglect to give as much attention to before I head out. Obedience training, we try to start with puppies as far as recommending that, just so they're off on the right foot from the get-go. Speaking of feet, foot handling is another thing that I would really encourage people to do with a dog as a puppy, especially, but even if not, if they're an adult, just go ahead and get them used to you just investigating their feet, looking in the furrows between their pads. That's where little awns and things love to get stuck. So just get them used to that before you actually need to use that particular skill on the trail. Recall skills. I'm a big proponent of leash walking on trails. I think a dog is an exceptionally well-behaved and trained dog if it can not be on a leash and do everything that it's supposed to do. That takes a lot of work, and a lot of people don't have the time for that. But if your dog is one of them, I can give some grace for that usually, but most people I would encourage to put your dog on a leash for your protection and for theirs and for other dogs' protection. I've seen some nasty fight wounds from dogs who are not on leash on trail, and they come around a corner and just react sometimes. Rattlesnake aversion training, that's hit or miss depending on your area and your dog too. You have to be careful with rattlesnake aversion training. We have positive and negative reinforcement type training disciplines, and typically rattlesnake aversion, I think, you can scare a dog into being spooked by anything that remotely looks like a snake or sounds like a snake. So you just want to really check the references and reviews on the trainers and that type of thing, and really get their honest opinion on that thing or on that type of training. And then check land use regulations. This is another one. I live right on the border of Great Smoky Mountains National Park, and that one is it's something I see abused regularly. People are not allowed in the park with their dogs, with the exception of 2 trails, but I see people out there all the time, and they can get fined at a minimum, but certainly they can have some bad things happen. Bear encounters, that whatnot. Just respect the land use regulations, whether you agree with them or not. So first aid supplies, when I made this slide, I thought, oh my God, this is ridiculous how many things I keep adding to it. The things in bold are the things that I would deem more canine specific, probably not things you already have in your first aid kit. The other ones, that very short list of only 4 things, are probably some things that you already carry, or maybe not, but variations of them. The thing at the top where I wrote ready-made versus homemade, that medical kit there in the bottom right of the slide, that's one that you can buy like at REI, or lots of outfitters have them, and they're okay. They either have too much of one thing or not enough of another, or not something that I recommend at all. Like I seriously doubt many of them have baby oil, or even a thermometer for that matter. And those are things that I think if you're out there with your dog a lot, depending on the terrain you're hiking in, there are some things that you probably want to supplement one of these ready-made kits with. I will update my list because I did add a couple of things to this tonight before I started this presentation. So I'm going to update the list on my website, but I will put all this in there. And I've put in parentheses why, in a lot of cases, I would recommend, say, needle nose pliers. If you're like me and you live in the Southeast, we don't have porcupines. So knock that off the list. There's really no need for it. Um, but, something like a thermometer, if you're in a hot climate or hot and humid, even more so, I would encourage you to take a thermometer if your dog is likely or prone to getting overheated, or even if it's not. There's a hyperthermia where a dog gets too hot is something I used to see regularly here in the summer. And it's life-threatening a lot of times, and not every dog makes it through hyperthermia. So that's one that I would want to, carry a thermometer for to be able to more closely gauge that if a dog started showing signs to separate it from something else that might be happening. Um, yeah, but the rest of these I think are fairly fair. Well, we'll get into a few of them, like Musher Secret and the calendula salve. Those are things that are more specific to like through hiking dogs. The other thing I'll mention before we move on that's probably not as obvious is the slip leash, muzzle, or paracord. Any dog who's in pain is going to be prone to biting you, whether you're their owner or a stranger, the veterinarian, whoever. They just don't discriminate sometimes, and you just want to be careful. So, you don't have to bring one of those things. The slip leashes are just those little leashes you get from the vet that, they all have them right outside. They usually have their, like in the foyer or somewhere, they have them branded with the vet name on them. And they just make a really good muzzle in a pinch. They're not as easy to put on as you would think. Paracord, you could fashion some kind of a slip knot on there, or just a muzzle. If you've got a dog that's a known biter and is really, really reactive with pain, you might just want to even carry a soft muzzle that doesn't weigh that much. And then this canine field medicine, I have this little physical copy of it, but I think that it's probably better served for most people to download the digital version. I think that exists. And then you've got a reference in the field for any types of medical care needs. It's a great little book. It was actually a veterinarian who wrote it, and I think it's a great resource. So restraint, I'll talk about just briefly a few different methods you can use. Say your dog is acting painful or sick, whatnot, and you want to look at them better. The first thing I always recommend is don't touch them at all. Just, kind of do a hands-off exam. Look at their breathing. See if anything looks abnormal about it. Look at their belly. Look and see if it's bloating. Are they standing funny? Does their, coat look different? Is it starting to bristle in places, kind of like they might have some hives? All sorts of things you can get from just a hands-off exam. This is Austin, a search and rescue teammate of mine. This was a little hound dog that we ended up rescuing in addition to somebody who was lost, and that's a frequent thing here in the mountains. But he looked a little bit, I would say, just worn out, and so we were doing a little exam on him. But I was looking at him right there before I even laid hands on him. Beyond that, though, you do want to have some restraint techniques, kind of, just in your arsenal of tools. And this is probably the most effective and easiest for a dog that's not comfortable getting on the ground if they're not already laying on the ground for some reason. Just this, kind of neck hold. You don't want to strangle your dog, obviously, but if you can have someone just kind of put their neck in the crook of their elbow while you examine them. Now, if you're out solo, of course, you can't really do this as easily. You can do it and kind of do a half exam. It's not the easiest thing to do a full one, but that is, I think, probably the quickest and easiest way to look at a dog. This, though, however, if you have another person to help you, this is by far my favored position for looking at a dog, just kind of head to or nose to tail and doing a better exam. We call it lateral recumbent hold, and there's other names for it, but that's the most common one. Essentially, you've got the dog on their side, and you want someone to hold the forearm that's closest, or the leg that's front leg rather, that's closest to the ground, and just kind of, just kind of pin it to the ground, for lack of a better way of putting it. Not where it causes pain, but just to secure it there. And then with the other hand, you can either hold both feet like I'm doing in this picture, or one foot. I would hold the top one if you're only going to hold one, probably. And that, my dog actually had cancer in this picture. She was pretty sick. And so she was very cooperative. Not every dog likes to be held down like this. So it might not be possible, especially if your dog having some kind of respiratory issue. This is not an approach I would recommend, but it's something that you can do if, foot injuries are so common. And this was definitely a great way to look at all the feet pretty quickly if you can be efficient with it. So vitals, again, this will be in the document, so you don't feel like you've got to commit all this to memory or write it down fast. Heart rate, small breeds, their hearts usually beat faster than big dogs. And I'm going to show you a slide here in a minute to show you where you can find the pulse on a dog pretty quickly. Takes a little practice. This is something you want to practice at home. Capillary refill time is a really good gauge of just perfusion, blood perfusion. And the way you can do that is just lift up a gum and then just press the gum and see if it blanches. And see the color as well. You want them to be pink, but not like purple, red, kind of even bluish pink. Those aren't good signs. You know what dogs' gums look like in general. So as long as it looks like that nice kind of bubble gum pink, that's what we're after. And you want the blanching to go away in a second or less. Respiratory rate, panting. I do want to make note that it's not always just because the dog's hot. It could be because they're in pain or just excited, and running around. Or some disease processes actually cause panting too, but that's not something you'll probably notice for the first time on the trail. That'll be something they're doing at home too. Temperatures, again, we'll get into why I recommend that thermometer mainly for hyperthermia. Those are your normal temperature ranges for dogs. Of course, those are higher than our, 98.6. Rectal readings are by far the most accurate way to get a temp on a dog. That's not a fun thing to do. Nobody likes it, but it might just save your dog's life, if you're treating it for a heat situation. Dry noses, unfortunately, don't necessarily give you a lot of valuable information, so I wouldn't really lean into that as far as a reliable indicator of a fever or dehydration. The only thing that might help you a little bit with a fever is putting a thumb in a dog's ear canal, just not very far, just far enough that you can put your thumb in and put it, rest it inside the ear. And if it feels a lot hotter than you think it should, that could be an indication of a fever, but not terribly reliable. So the pulse again, this is a good one to know how to do. Couple different ways to do it. The one that's more challenging is on the left side, and that's looking for the femoral pulse or the femoral artery. If you can imagine, the other side of my hand that you can't see cupping the meat of my dog's thigh, the inner thigh, and there's kind of a natural groove, that you'll feel kind of closer to the knee than to the back of the leg. That's where that artery lives. Sometimes it's more on the midline of that leg. It just kind of varies per dog. Sometimes like a real meaty leg, like a pit bull or something like that, it's hard to find it. And it's hard to find even in a really lean, easy to find dog. You just have to practice, but practice at home. Dogs, if you're loving on them, they're probably not going to mind you doing this. But you just want to kind of cup that thigh, and with the palm, with the fingertips of the palm is where you're going to probably catch it. And once you find it, you'll kind of commit it to memory. It's almost like a muscle memory thing. You'll know where to look next time. Or the easier way to do it is just between the elbows. A dog can be standing. I took these pictures tonight. My dog was being really lazy, so she didn't want to stand. But I think it's easier if they're on the ground to scoop your arm or your hand rather up under them and try to find it from that side of the body that's closest to the ground. It's just going to put more weight on your hand versus you putting, weight on the top of their thorax. It just, for some reason, it's easier. You can usually find it quicker. But again, practice it at home. Hydration status, couple different ways. Gums should be slick and moist versus dry and tacky, of course. Sometimes it can fool you though if a dog's nauseated and they're drooling a lot, they'll feel really slimy and slick, and that's not necessarily that they're hydrated, it's just they're probably going to puke soon. The neck skin tinting technique, gosh, that's a mouthful. That's when, and I've got a video, I think, here in a minute, where you just lift up the back of the skin on the back of the neck or just down the spine and see if it retracts quickly. There's some degree of subjectivity to that. It used to be they would say if it takes this many seconds, they're this much dehydrated. And I don't know, that's hard to really gauge. But if it takes a while to go back, that's usually indicative that they're kind of dry. Pain indicators, a lot of these are pretty obvious. If somebody's vocalizing or licking or chewing at a spot just relentlessly on, say, a paw, that's usually an indicator something's not right. Elevated heart rate, that's another good reason to check the heart rate. If a dog's just pacing, restless, just can't get comfortable. Panting, certainly something we see with pain. And then again, even the best behaved dogs may bite when they are in pain. So just be really mindful of that. I've seen so many people come in with bites when they've come in with a dog off a trail that they were trying to, do something to before they brought it in, and they ended up getting bit by their own dog, and that's never fun. So just be careful. So this is the video yeah, this is me testing that skin tinting. That was really, it was effective. It was fine. I'm just palpating down Josie's spine just to look for any sore spots. This is me looking for her pulse, and I think it's better just to cup either side to find it easier one way or the other. If your dog, if you're just trying to troubleshoot and find like where are they painful, they're acting like they just don't feel good. I'm palpating her belly right now just to see if I can find a sore spot. And then legs are another good thing just to kind of do a full rotation with, full range of motion type test. And I'll show you here in a minute another video where I'm testing, looking more at her paws. But yeah, that's all that is. So we'll get in now to just some more specific things. So we're kind of, past the point of you've done all the things to get them ready for the trail. You've gotten all your homework done, looking for the pulse, all those things. But now you're on the trail and things happen. First thing I'll talk about is some of the more common animal type problems that we might run into. This dog on the right side of the slide, those are all ticks, as gross as that is. This is not a picture that I took. This is a borrowed picture, but this is something that we saw, once or twice a year, maybe just stray puppies, dogs who weren't very well cared for, didn't have good preventative care, that type of thing. And it's the most heartbreaking thing ever. We usually have to sedate these dogs to get all those ticks out, but it can be that bad. Hopefully, it won't ever be that bad for you, especially if you've got your dog on tick prevention. But ticks are active anytime the temperature is over 39 degrees. So, it's not common for them to be out when it's that temperature, but it can happen. So just be mindful of that whenever you're out. And tick-borne disease, thankfully, it doesn't just happen immediately. It takes at least 24 hours for a tick to be attached for the disease to be transmitted. So if you can catch it in that time, or the product that they're on catches it and it falls off, you should be good to go. You want to check, I like to do just tick checks on myself and my dog when I take her out, whether she's on tick prevention or not. Ears obviously are a real hot spot. Ventral abdomen, and then the flank region are really common places that we'll find ticks. They like warmth. Removing ticks with tweezers, I think, is the most effective way. If you can keep your own fingers off of the tick, I think that's, just better for our own protection. I think sometimes if you just kind of wiggle the tick a little bit before you take it off, it just kind of, I don't know, it agitates it and it just seems like they come off a little easier. The head should come out. If it doesn't, don't panic. It's probably not the end of the world. And then if you can keep the dead tick, if you just want to be really diligent and keep that dead tick and say like a Ziploc, just in case your dog does show signs of illness, a couple weeks later, it's just helpful for us to know maybe what the tick was that they were, that was on their body. Tick paralysis, I'll just touch on that briefly. It's not very common, but I saw it enough that I thought, wow, it's more common than I thought it would be. That is the saliva of certain species of female ticks. It will cause at first just kind of a wobbly, we call it ataxia, in the legs of a dog, but then it can cause an ascending paralysis, and it can get pretty severe. But luckily, the treatment is to just take the tick off, and supportive care, if the dog's struggling, as they kind of reverse and get back to normal. But it's really cool because it's like the cheapest treatment ever. You just pluck the tick off and watch for him to get better, and so everybody's happy, and of course the dog's happy and saved. But it can happen, so just be mindful of it. So insect stings, really common, especially here in the Southeast. We have so many yellow jackets and wasps and all kinds of stuff that bite and sting. Typically, a dog is not going to die from an anaphylactic reaction from a bee sting or an ant bite, but they can swell. This dog on the right, obviously, he's got a really swollen muzzle, and they can get itchy. They can be just really irritable because it hurts. They can get hives. You'll see like little tufts of their fur that kind of gets agitated and hives, and it kind of, sticks out more than the rest of their fur. If you're seeing a stinger, even in your own skin or in the skin of a dog, I think if you've got a little credit card on hand, just swipe it off that way instead of trying to pick it, with your fingers or tweezers. It's so hard to see and to grasp them. But a credit card will just swipe it right out of there because they're not very deep. Benadryl is perfectly acceptable to give to a dog who's had an insect sting. It may not do a whole lot, but it'll make us feel better. It's just like when we take Benadryl after we're stung, and it might prevent some of the side effects from coming down the road. The dose, if you've not ever given Benadryl to a dog, you're going to look at the dose if you've got like a lab and freak out and think, I don't even take that much Benadryl, and I'm 3 times as heavy as my dog. It's okay. It's 1 milligram per pound. So that means, a 100-pound dog would take 4 25 milligram Benadryl. So that would be, if you take two, it's double what you take. And I promise it's okay. It might make them sleepy, or rarely it can really excite them, but Benadryl is usually fine to give. And any of these medications I'm recommending, check with your vet. Don't take my word as like, just the word of God. You've got to check with your vet with all these things. I can't think of much that would make a Benadryl contraindication recommendation, but just be on the safe side. So snake bites, and this is one when I was in practice, I felt like, if we didn't have a week in the summer without a snake bite, we were going to get hit hard with something the next week. It was just going to, blow up on us because they were coming. And we have copperheads and rattlesnakes here in North Carolina. I know out west you guys have different snakes, probably more varieties of rattlesnakes. We have water moccasins in other places in the southeast, but they all do different things. Their venom works in different ways. But if it's a venomous snake, obviously you want to get it to the vet no matter what. Even if you suspect it was a dry bite, there's no way to really tell. So you just get your dog to the vet. Even if it was a non-venomous snake, I would recommend that because you've just inoculated 2 teeth into that dog's skin that carry all kinds of nasty bacteria. So you, at a minimum, will probably have your dog on antibiotics. But if you're on the trail and say you see the snake bite the dog, you try to get a photo safely. Don't do this if it's going to put you at risk or the dog at risk again. But it's nice to know the type of snake that bit your dog. And sometimes people will confuse, say, copperheads with water snakes. And, they'll bring a dog in and say, I know it was a copperhead. And it's probably more, show us a picture and then it's a water snake. So it's nice for us to have that information, just because then we know it'll save you money too, because if it was just a water snake, we know that we really don't need to pull out the anti-venom or even recommend it, which is super expensive because you just need supportive care for a non-venomous snake. And that's essentially what you need for a venomous too. But if your vet carries anti-venom, or the emergency hospital more likely who's going to carry it, it can get costly real fast. Luckily, most dogs live through snake bites, no matter what it is, at least here. But it can be a long road. It's not a fun road for dogs who are envenomated with a venomous snake, the venom of it. But as far as treatment, let's say your dog gets bit on the trail and you're pretty sure that it was a venomous snake and your dog is uncomfortable, it's starting to swell. Those are really good indicators that it was a wet bite. You want to get out of there. The thing you don't want to do is to keep your dog's heart rate up. If it's a small dog and you can carry it, my dog is behind me groaning right now if you hear that noise. But you just want to get them out as quickly as you can, but keep their heart rate as low as you can because you don't want that venom to circulate more than it already is. The things I definitely want to impress upon you is what's in bold there. Don't use suction, ice, tourniquets. All that stuff is just junk for either you or your dog, at least in terms of venomous snake bites. So leave it all at home. I mean, ice you're not going to have on the trail anyway, but even if you get back to your car and you've got a cooler with drinks or something, don't put ice on the bite. And then again, take your dog to the vet no matter what, and get it treated. And just, I think sometimes prevention is really important with snake bites. I mean, you can't avoid all of them, but keeping your dog out of, holes, like my dog is looking into a drainage pipe right there. And I just did it real quick to get the picture, but places like that, places that snakes like to live and under logs, that kind of thing. Just try to keep your dog from nosing around all the time because that's usually where they get bit, is the muzzle or the front legs. That dog in the upper right, you can probably appreciate there's a puncture there on his muzzle. Skunk sprays, I'll mention, not a lot you can do out in the field except if you have some saline or, something you can just put a little bit of water in their eye just to rinse out their eyes if it even got into their eyes. If not, don't worry about it. But if you want to just try something at home versus saving the money for a vet visit and try something at home, this is kind of the skunk stench cocktail that seems to be the most effective these days. That you've got probably most of the ingredients sitting at home, or they're easy to get. You're going to likely need to do this more than once. You will even smell that skunk probably for months on end every time the dog gets even remotely wet. That's all normal. You can't get rid of all of it. Just initially, it's a challenge to get rid of it at all. But it will eventually fade. And then wash the head and the ears last because, if your dog's like mine, as soon as you start to wash the head and the ears, they're going to shake their head. And then guess who's going to get all the, skunky stuff on them too. So just be mindful of that. Toxins, this is a big one. There's so many things that can be toxic out on a trail that your dog may or may not even care about mushrooms on the trail, but we certainly used to see dogs come in that just had this affinity for eating every mushroom they saw on trail, whether it was edible or not. I mean, they don't discern at all, and it always just perplexed me why they would even go after the mushrooms, but they did. Some of them did, and so the quickest way to get rid of, say, if a dog eats mushrooms, to get to come back up before it starts to absorb into their system is hydrogen peroxide. You're probably not going to have that on the trail. You could certainly carry some. Peroxide can be a little questionable with certain toxins, so it's hard to make it a blanket statement for anything your dog eats. You kind of want to check with your vet first if you can. And there's a dose in the notes. I think it's a 0.5 milliliter per pound. I always have to look it up. And then you have to extrapolate to make it like teaspoons and tablespoons and all that. But there's a formula in the notes to do all that. But mushrooms, yeah, are certainly, if they're toxic to us, they're going to be toxic to dogs too. And any uncooked wild mushroom is generally considered, at least at a minimum, a GI, distressor. You need to cook things like morels and chanterelles and all that to make them not upset your stomach. Trail mix, that's probably the biggest culprit we see. You've got chocolate in there, you've got raisins, which are in grapes as well, are toxic to dogs. I mean, same thing, obviously, but you just want to be careful with trail mix that has those things. Chocolate is dose dependent, and it's also the concentration of chocolate dependent. So, say, like if I've got a lab who eats a Hershey's chocolate bar, I'm not too concerned about that lab. But if I've got a Chihuahua who gets into some, like 85% dark chocolate, I want to see that dog. That's going to be a potential seizure situation. But most dogs that get into just plain run-of-the-mill trail mix type chocolate and an M&M maybe will have some GI distress, but typically not the more severe symptoms like seizures. Trying to think of some of the other things on this list that you would run into on trail. Macadamia nuts, I put as asterisk by just because I wanted to remember to mention it. I love macadamia nuts in my trail mixes. I use it regularly, but it is definitely toxic to dogs. So don't feel like you can give it to them like a peanut. It causes rear limb paralysis. I've actually seen it. I had some clients who had just gotten back from Hawaii with a big crate of macadamia nuts, and their golden retriever got into it, and they came to me with the dog paralyzed. And luckily, it usually works itself out, but just obviously you don't want it to happen. The other thing I want to mention, because it's become a bigger problem in the last decade, is THC toxicity. Dogs definitely get stoned, and it is toxic to them. It's not like a human who's, it's just different. It is a toxicity to a dog. And with edibles and that type of thing, it's a bigger problem than it used to be. And one of the things that your dog will do, besides acting stoned, a lot of times will just urinate while they're lying there, riding out this high. And, we test their urine. We do the same things we would do for a human. I've never seen a dog die of THC toxicity, but it can take a while for them to recover from it. And if you've got a dog that's like that on the trail, obviously it can really become a problem to get them out of the woods. But you want to try to get them out of the woods and keep up anything that you may have in that regard so the dog can't get to it. And I've even had dogs eat resin out of, like, pipes and things. They'll just eat anything, certain dogs. So just keep any THC product away, whether you think it might be appealing or not. To some dogs, it is. Heat strokes. I know I've already mentioned this a couple times. I want to definitely spend a little more time on it though. Predisposing factors for heat stroke are dogs who are under conditioned, just like people, dogs who are obese, older, ones that have comorbidities, especially things like heart disease, brachycephalic breeds. Remember, those are the dogs that have kind of the snub noses. And then even dark-coated breeds, they're just going to absorb more heat if they're exposed to direct sunlight. And the signs with heat stroke, this is where it gets tricky. They can be really hard to discern when you've gone from just a dog who's just hot because he's hiking to a dog who's starting to encroach upon this is not good hot anymore. It's getting scary. And the first thing that you're usually going to notice is just heavy panting, rapid panting. A dog just can't seem to catch its breath. I think panting can go up to like 200, breaths per minute, but that's hard to count. So your dog, if it's panting more rapidly than it normally does, that's something to pay attention to. And panting at rest, if you stop because you've noticed something seems off and they can't stop panting, even though they're in the shade, you've given them some cool water, you maybe even doused them with a little water, that's definitely stay put. Don't move anymore. You really need to stay put and address this. And if the dog is getting into the, more severe stages, they may not be able to move anymore. You may be stuck whether you like it or not. Some dogs will have kind of increased drooling when they get more advanced, high heart rate, even at rest. That's another reason to check the heart rate. Brick red gums, if you start getting into those brick red gums, you're getting to the scary zone for sure. And then the most severe signs are things like bloody diarrhea, paralysis. They just can't move at all. They've just kind of got this glassy eyed appearance like they're checking out. This is a serious thing. You really want to be careful with heat stroke. Treatment, I've written all these things down here and put pretty much everything in bold because it's all important. Shade, no brainer if you can find it. If you can douse the dog with some kind of water, even just water from your water bottle, and then fan them if you have like a pack towel or just even some clothing to fan them with for evaporative cooling. Cool water bottles, like in the femoral artery area and the groin, is somewhat helpful. Cold water immersion, not ice cold water. I mean, if all you have is a mountain stream or a, alpine lake, then do what you have to do. Preferably there's different thought processes with this. When I went to school, they said just don't do super cold water, period, because it can really mess things up. The science has changed a little bit. Now they're saying that's okay. The thing that you run the risk of is those arteries, or those veins rather, starting to contract. You want everything to dilate, and if you do super cold water, that's just our body's physiological reaction to that, is to try to, get warm and shut things down a little bit. So, just cold water is fine if that's all you have, but just, if you had like a bucket of ice or something, don't just dump it on the dog. That's too much. And then this is where the thermometer comes into play. If you've got a dog that you're treating for heat stroke and you've got a thermometer, they're not going to care that you're putting something in their butt if they're that sick from this. But once you get to the 102 to 103 degree range, go ahead and stop what you're doing. Still, I mean, their dog's not going to move if it's that severely affected, but you don't want to keep doing more because you can actually tip them into hypothermia if you go too far. If you've got a dog who's really, really affected by heat stroke, 83% of dogs, I don't know where this study came from because I heard this in another webinar. Heat stroke, it was veterinarian though, heat stroke dogs will survive if they're seen by a vet in less than 90 minutes. So if you've got a dog who's really affected and you're close to getting out, get that dog out, get them to the vet. And on the way, if you've got a friend with you, get them to help you treat that dog. Altitude sickness, this is the only slide I don't have a dog picture of because I've never had my dog at altitude. That's me on the Colorado Trail that I thru hiked last summer. But they can get it just like we can. And it's very similar to the symptoms that we get. Shortness of breath that can progress to, more severe difficulty breathing, vomiting, nausea, loss of appetite, increased heart rate, lethargy, that type thing. Same treatment that we have, descend, get out of 8,000 foot or above elevation. And then definitely if they're not improving once you get down pretty quickly, they should improve, get them to a vet stat because they might have, some more advanced signs that need to be treated. Preventing it, if you've got a dog who is brachycephalic, again, I keep picking on these poor brachycephalic breeds, but they're just not meant to be out in most of these conditions, or dogs, say, with like heart disease, they're just not going to be good candidates for altitude. And even if a dog is a good candidate, just like yourself, try to acclimate gently and gradually if you can. And hydration matters too. Take a drink real quick. So garbage gut, that is a display of backpacking food for my family for a spring break trip. And our dog Josie, who when our kids were young, you can tell she's just a big fat pig, would love to feed her all that food and thought it was, fun to feed the dog on the side. So she was really always struggled with weight. But a lot of dogs are like Josie, they're like little vacuum cleaners and they'll get to food any way they can. And if you leave food out on the trail and go take a pee break or something and they get into it, you can have some issues from that pretty quickly sometimes with dogs, depending on just how sensitive they are. The signs are what you would think: vomiting, diarrhea, lethargy, maybe drooling if they're nauseated, dehydration. If you're just out on a day hike, it's probably time to reverse and get out of there just to avoid, a dog that's feeling pretty sick a couple hours further into the wilderness. And once you get home, I would say just don't feed them probably dinner and just offer small amounts of water depending on if they're vomiting or not. So eye trauma, we'll go over this one really quickly because it's pretty easy. If you've got a dog who's squinting, cloudy eye like this, pawing at the eye, anything that's just wrong with the eye, eyes can go from bad to or good to bad really quickly. So you want to treat those accordingly at the vet. This is not something you can usually manage on your own. If you've got something this severe going on, get them out. But if you've got some saline, just rinse out the eye. I can't think of any contraindication for much to do that in the wild, and get them out, get them seen. Hemorrhage, wounds, and lacerations, things like ears, tails, nails, and mouths bleed a lot. And they're usually not life-threatening bleeds, but they just look like they are because they just go everywhere, especially tails. So just keep everything in perspective. Your dog's probably going to be fine if it, gets an ear laceration or whatnot. He's just going to keep shaking blood everywhere, all over your car and you and everything else. Lower limbs compression is always a good idea if it's a bleeding wound, and bandaging before you get out if it won't stop bleeding. Once you get higher up on the body, it's hard to bandage. Compression, is certainly effective though. Chest and abdomen type bleeding, that's obviously can't really compress those. Get them out as quickly as you can. Limbs bandaging, you want to do it tight, but not so tight that say their nails start to split, under that bandage. You want to go all the way down to the foot and bandage it, but you want to keep the nails exposed. And if they are starting to separate, you've gone a little bit too far, you got to redo it. Wounds, you could irrigate, sometimes Sawyer or not Sawyer, any kind of water filter can be effective. And don't wait on vet care if stitches are needed, because if you wait, we've kind of got this golden window that we like to stitch things up. Otherwise, we have to freshen up the edges of those wounds, and that's no fun. Even though it's under anesthesia, it's still no fun. And no licking allowed. Dogs, they think they're doing such a great thing to lick wounds, but they're not. That picture of the bulldog looking thing on the left, that's just if your dog had an ear wound and he's just splattering blood everywhere, you could take, if the head would accommodate it, something like a tube sock or ankle high sock, and cut off the toe and put it up over his head with maybe some bandaging materials to keep it from bleeding. Ortho and soft tissue, kind of the same vein. Fractures versus sprains and strains. Sprains, you're probably going to, just see a dog. I mean, they can certainly carry their limb when they're having a sprain or strain, but fractures, they almost definitively will carry that leg and just not touch the ground with it. All these things probably need to be seen just to make sure. If you're trying to discern which leg's affected, if it's a front leg anyway, when they're walking, usually the leg that's not affected is their head is going to lower when that leg hits the ground. Not something you really need to know, just kind of a fun fact. You can only splint if you do decide to try to splint a dog's leg because you're worried it's broken or sure it's broken. You can only go up to the elbow or the knee. You're not going to be able to get a splint higher than that. SAM splints are really effective. Those are something that we usually carry for ourselves, but they can be effective with dog limbs too. And then pain relief. Don't use acetaminophen, ibuprofen, any of the human products. Just stay away from them. This is me looking at Josie's paws, just trying to give you an idea of how you can look in those furrows and get pretty deep in there, because that's where things like to hide, especially sores and whatnot. And then as you're just trying to figure out where they hurt, just kind of go up the leg. I'm doing it really quick there, but you can take your time and just really flex each joint and just feel every bone and muscle and just kind of, not get aggressive, but definitely be thorough with it. Head, spinal, and pelvic injuries, these aren't really common. I had this slide for some paramedics that I was teaching this to. And so we were talking more about evacuating and how to carry these types of dogs out. I've seen dogs have injuries. One died actually falling from a waterfall. So they can happen. Wet tail syndrome, that's probably more likely to happen if something's going to happen that you think, gosh, what happened to this dog? Why is its tail paralyzed? I didn't see it get injured. That can happen when a dog is exposed to really cold water. So if they get in a mountain lake or stream, they can just have this really unresponsive limp tail, and it usually works itself out in a couple of days, but doesn't mean that anything's wrong with the spine or there's no break in the tail. It's just this weird phenomenon that happens. But broken pelvises, head injuries, anything in this category, get them to the vet. This is something that's automatic vet worthy, and get them out as quickly and safely as you can. CPR, also not going to spend a lot of time because it's just not real effective in dogs, even in veterinary hospitals, but especially, people doing it who don't know necessarily how to do it because they've not been trained, like in a CPR course you take for yourself. But if you just want to know it, just to have it on hand and in your mental memory bank, you want to think of it backwards than what you would think of with a human. Instead of pinching the nose of a dog, that's where you're going to breathe into, is into the nose, and you're going to close their mouth because, as you can imagine, the anatomy makes it more conducive to working that way versus a human, which it's the opposite. So just think of the opposite way of those breaths, the rescue breaths. The compression rate, luckily, is the same as humans, 100 to 120. If you can remember the Staying Alive song, and that's the cadence, the tempo rather, that you want to keep. And you want to compress a third to a half width of the chest. And there's some variation with where you want to do those compressions. There's a video I'm pretty sure I have linked in the resources that it's a good video because he goes into all the different types of anatomy that you could encounter with dogs and what's the best way to, or where is the best way to compress the heart the most effectively. Through hiking, I do want to touch on it in case anybody's planning some wonderful through hike with their dog. I think I have it in the resources. I'll double check. There's a great podcast. It's Backpacker Radio. It's, I think, like 4 or 5 years old, this podcast, but it's a veterinarian, and she is a highly qualified veterinarian. I mean, she just puts any credentials I've ever had to shame. She's board certified in a few different areas, but she through hiked the Colorado Trail with her dog. And she's just an amazing vet. So she's just a huge wealth of knowledge. And I even learned a lot from listening to the podcast. But since she was specific to through hiking in that interview, it's really tailored towards that. So definitely give it a listen if you've got a through hike planned. But just here's some things to generally think about. Personality, age, breed, all those things matter a lot. A dog going on a day hike, I can see just about any dog in the world tolerating that just fine, except maybe the poor brachycephalics. But, through hikes are a different beast. You really want to be careful and intentional about the type of dog you take out there. And that's one that you'd want to talk to your vet about, not really, ask me that question tonight because it really is a lot of factors. Physical, vaccines, microchipping, all super, super important. And say your rabies vaccine is due 4 months from the time you leave on a through hike, and it's going to take you maybe 6 months to hike the trail. I'd go ahead and boost it. You're going to be out there 4 months later and needing to get it by law, and for your dog's protection too. It's not going to hurt it a bit. If a dog, say I used to have a patient who ate bats all the time out of a barn, and I must have vaccinated him for rabies probably 15 times in my career because every time the state recommendation was to boost his rabies vaccine. So they do fine with those boosters ahead of time. Train on similar terrain as much as you can, get their paws especially accommodated to whatever it is that you're going to hike. Gear, a little bit too much to go into with this particular workshop tonight, but you just want to have the appropriate sleep system, pack, all that kind of stuff dialed in, and the dog used to it, and do some shakedown kind of hikes before you head out. Obedience and recall, of course, important. Daily foot care is so important. Booties have their place. They are not something I recommend for most dogs for just day hikes. At least generally, but for through hikes, there could be some situations where you'd want to have them on hand for sure. And then calendula salve and Musher's Secret, those are things that I would definitely have on hand. I learned that actually from the podcast I just mentioned. Calendula helps treat, just minor sores and whatnot on wounds. And then the Musher's Secret is something she recommended and used on her dog underneath the booties. It's kind of like think of it as like Body Glide for dogs. You don't want to just put it on and then let them hike on their bare feet because it can collect all kinds of stuff like dirt and stuff that you don't want it to collect in the paws, but it's great for booties. And then appropriate diet and supplements may or may not be appropriate, but you definitely want to dial in your dog's nutrition so they don't, wind up at the end of the hike looking like these poor hunting hound dogs here in the mountains. And then public land restrictions, you want to plan that out, like the Smokies, people shouldn't hike through on the AT in the Smokies. So you've got to have a plan of where you're going to board them or who's going to take them for you, that type of thing. Nutrition and hydration, another big slide, a lot of information, and I'm looking at the time. I know we're getting close to, well, the hour. You want to look generally, if you just want a blanket statement for food that has this AFCO rating, that acronym, it's, stands for, I can't even read it right now because it's too blurry on my screen, but every food that's worth anything, in my opinion, has the AFCO rating seal. And that to me is a far better indicator than watching a commercial for some boutique brand who's spending a lot of money on marketing to convince you that it is the end all be all food. Talk to your vet. You can even do a consult with UC Davis Vet School. They have a nutritionist who will do a consult with people, even if they're not, a patient at UC Davis. That would be a really good use of your money and time. And then just some guidelines for body weight in relation to how much weight you want to put, in a dog's pack is there, 10 to 20%. I would err on the side of 10 if you can get away with it. To filter or not to filter water, dogs have more of a tolerance. You think about their ancestors, they had to drink just natural sources. They probably weren't as contaminated as our water sources now, but dogs do have more of a tolerance to things like Giardia, and the burden has to be, I feel like, a little bit bigger in a dog than it does us to cause clinical illness. And then water, your dog's probably going to take care of that need by itself. But if you just want to geek out on numbers, an ounce per pound per day is kind of their minimum requirement at rest. And then the other thing, that RER, that's resting energy requirement, I think is what that acronym stands for. It's been a while since I've looked at this one, and that's the formula to see their basic caloric need at rest. And then you might need to bump it up to 5 times that on a through hike, depending on the mileage you're doing. That food on the right, the Honest Kitchen, that is an AFCO approved food or an AFCO, qualified food. And that's something that I mix in with my dog's dry Royal Canin food and just in everyday life. And they sent me a box of it a long time ago to try it just because they knew I was a, hiker, backpacker and all that. She liked it so much, I've just used it. But it's a great, they do make these dehydrated foods that are nutritionally sound. I even consulted with a veterinary nutritionist just to make sure that that one was okay for everyday use, even with the AFCO rating, and she looked and said it was. So that's a good one. You can order it online. Evacuation, if you ever should have the need, hopefully you never will. The left-hand side, that's a hound dog. We see a lot of hound dogs on the trails out here that we have to take out. But that's one whose owner was helivaced out about 10 minutes before I took that picture. And this was his hound that we wound up carrying out because he was so scared of the helicopter. So that's certainly an option if it's a dog that's conducive to carrying on your shoulders like that. They do make these different types of harnesses that you can buy. I don't have any experience with any of them to give you a personal recommendation, but this Rough Rescue I've heard is pretty good. And then the last thing is just that Garmin InReach, just to remind me to tell you, I can't think of a search and rescue team out there who wouldn't want to come to a dog's aid. In fact, probably a lot of search and rescue team members would do, want to come to a dog's aid sometimes more than a human, So just because it's going to be hopefully an easier carry out and not so big, as far as the weight, and because we usually are generally dog lovers. But if you have a situation where you can't get your dog out yourself, don't hesitate to call 911 or hit that SOS button. You're at risk if you can't get out and you're not going to leave your dog too. So I can't imagine a search and rescue team turning that down. Certainly not ours. And that is where I will wrap it up. I was trying to get this done 10 minutes till, but I've gone 10 minutes over. But I hope that people are still hanging in here, and I'm happy to answer questions if we have them. I'm going to try to get out of here. Christina, I may need your help. I'm going to go back to, there we go. Hang on, I can't hear you.
It should be at the bottom under the share option. You should be able to click it and say
Oh,
stop
right,
share.
right. Yes. Well,
Let's see if I can do
stop
it.
share. There we go. Okay. That do it?
Yep.
Okay.
If anyone had any questions, feel free to pop them in the group chat or just unmute yourself and shout them out.
I hope we have people still hanging on. I know that was a lot of information.
Yeah, I have a question. So I live in Arizona. I don't know if this is for all over the US or whatever, but Sedona gets really hot here. So one thing they were saying about like heat, stroke, heat, exhaustion for dogs is that not to throw water any temperature on. So I'm not sure just because it gets so extremely hot here if that makes a difference. But they say like get something wet, lay it down, lay the dog on it, start with the feet, get them cold, and then kind of work into it.
Yeah, it depends. I would say that's a little nuanced depending on how severely affected the dog is. If you've got a dog who's in dire straits and has those brick red gums and is just like looking, like it might check out, I wouldn't hesitate to really pour some cold water on that dog and saturate it as much as I could and even fan it from there because I would want to do everything I can to get that temperature down rapidly if they're to that point. Now, if it's just a dog who's, overheated, just needs to rest, things like shade and letting them drink some cool water and like, what you were just saying, all those would be appropriate. But yeah, it gets tricky. And honestly, up until about a year ago, I was still under the impression that we shouldn't really saturate them with really cold water because they used to say that it would throw them into something called disseminated intravascular coagulation, meaning their blood just starts throwing clots all over their blood, all over their vasculature, and it can cause just a massive problem and usually kill the dog. But now they're saying that, more scientific studies and stuff are saying that is not as much of a concern. It's, cold water is okay. To just dump ice on them, probably not so much, but cold water is fine. Does that answer your question though?
Yeah.
Yeah.
So I think it's whatever I have available and how bad they are as to what you want to
Yeah.
do.
Right. Yeah. And I mean, it depends. Because like I said, it's so tricky sometimes to tell when you're going from that edge of they're just really kind of overheated, kind of like heat exhaustion versus heat stroke. But to me, if you've got a dog who just can't stop panting and really is just kind of almost agitated, and even at rest and shade and all the things that you're doing to kind of just cool them down without doing any of these more extreme things, that's when I start getting worried. Like this is more serious. The worst you're going to do is aggravate him by putting on super cold water because it's going to, like, oh, that was really cold. But I don't think it's going to hurt. Is kind of the prevailing thought now.
And for rattlesnakes, so they do rattlesnake training with live rattlesnakes here in Sedona area, and they have the vaccine.
Yeah, the vaccine, from my understanding, because we don't really give it here, but from my understanding, it will delay the onset primarily of
Yeah,
symptoms
give you time to get
and
to the vet.
and give you more time. Yeah, so it's not going to really save you any treatment. It just, and I would think maybe it would just maybe lessen the severity of some of the symptoms or signs rather. So, but it will definitely, I think, in theory anyway, delay the onset. So that's a win, especially if you're in the backcountry.
Yeah.
I have a question.
Yeah.
Okay. It's regarding Giardia. So I'm in Colorado and it seems to be really prevalent here. So I hike with a dog. And one of the great things is when you have stream crossings, because it's less water to carry. And there's ponds, there's lakes. So she got Giardia once and treating it, it took 2 rounds to do it. So is there any, I guess, I don't know if I want to call it preventative, something you can give to a dog prior to? I mean, I do have a filter thing, but one of the things it's like, wow, this has got, 10 stream crossings. Great.
Right. That's the thing. And that's why I'm kind of like, good luck. If you've got a wet trail or just, any type of crossing to keep a dog from, getting into that water unfiltered, to me is just not worth the battle. But it can be a booger to treat for sure.
But there's
Yeah.
nothing that preventative you can give prior to hikes, some kind of, I don't know.
Yeah, I'm going to look real quick while we're talking here because I just want to see, because there has been. Yeah, there is a vaccine, and the reason I'm reluctant to say it is because I'm not too familiar with it. We didn't offer it where I was working, and so um, yeah, I would have to do a little more research. I'm looking to see if it's still here or still available, and it is. So that would be one that I would want somebody to talk to their vet about and get the pros and cons for that situation. It's probably not going to hurt to try it. I just don't know its effectiveness, honestly, to know how much to recommend it.
All right. Well, thank you.
Yeah.
Any other questions?
And again, people can reach out to me anytime. If they go to my website, there's a contact me somewhere on there, and happy to answer questions. And I'll try to remember to do a little more due diligence about the Giardia vaccine question or the Giardia question, but short of vaccinating and filtering water, yeah, not a lot you can do about preventing it, but I will update that document with kind of the latest research on it.
Well, we really, really appreciate your time. Thank you. It was really informative, even though I've hiked with a dog for the better part of a decade and I still learn something. So I really appreciate your time, and everyone, I hope you have a wonderful night.